Are you living in pain? Is it joint pain or muscle pain? If so, stay tuned. Welcome to Living Pain Free with Dr. Marc Darrow from the Darrow Stem Cell Institute in West Los Angeles. This is the program that can give you effective solutions for the pain you've been living with. Dr. Darrow is a medical doctor, board certified in physical medicine and rehabilitation. He teaches about the use of prolotherapy, PRP, and stem cells. Today's program could open up a new life without pain for you. Now, here's Dr. Darrow with his co-host, Dr. Nita Valens.
Good morning, Dr. Darrow.
Hello, Nita Valens. How are you today?
I'm great. How are you?
I'm living it up.
Yay.
What do you call a pig that does karate?
Oh, my God, the joke's so soon.
I wanted to catch you off guard.
Yeah.
A pork chop.
Oh, my God, that's hilarious.
Why did the bike fall over?
The thingy broke.
It was too tired.
Oh, God. That's hilarious.
Okay, one last one for now. Ready?
Okay. All right, ready.
Why did the golfer bring two pairs of pants?
One for the golf clubs?
Close, in case he got a hole in one.
Okay, should I introduce the show now?
Yeah, let's have some fun today.
Okay. Well, we do live in the fun zone here on Living Pain Free with Dr. Marc Darrow, and I'm your host. And what we talk about here is musculoskeletal pain, which is basically orthopedic pain, which is muscle pain, joint pain, disc pain, ligament pain, back pain, neck pain, hip pain, arthritis pain, knee pain, common issues that happen, and sometimes we don't know the genesis of it, such as you have dull aches, you have stiff joints. So basically, any kind of orthopedic issue, you want to call and speak to Dr. Darrow during this hour at 866-870-5752. That's 866-870-5752 right here in the studio. And you can it's kind of like having a free consultation with you. Really, it is. So we
call that a curbside consultation.
Oh, is that what that's called? Okay.
Yeah, it's like when someone catches a doc at a party or on the street and asks all kinds of questions.
I bet that's happened to you a million times.
I love it. I like what I do, and I love helping people. So yeah, it's a lot of fun. I want to hear your questions. I hope you do call us, and it makes the show a lot more alive when you do call. So don't be shy. You can pretend it's not you. You can pretend it's your brother or sister or your mother or whatever. Or you can ask questions about them or your friends. So please give us a call now instead of waiting for the end of the show when the callers are all lined up. And the phone number here to the studio is 866-870-5752. Go run and get your piece of paper. Write it down. 866-870-5752. And if you decide that you can't call in for some reason, call the office, get more information. The number there is 800-300-9300. And for those of you that are really shy, which I doubt you are, just go to the website and you can ask me questions there. Every page has a spot to email me. And the website is www.lastemcells.com. That's www.lastemcells.com. Love to hear from you.
Absolutely.
Now it's your turn.
Okay, well, let me just repeat the website in case you were scrambling for a pen, www.lastemcells.com. And there's tons of information there. You can email Dr. Darrow off of every page on the site, and you can watch him performing the treatments on videos. That's pretty exciting because I've looked. And the best part we didn't even tell you yet, which is when you call the program today, you get Dr. Darrow's latest book for free. It's called Stem Cell and Platelet Therapy, subtitled Regenerate, Don't Operate. It has 264 scientific studies, actually, and the foreword is written by the lovely Suzanne Summers. And it's chock full of information. It's a great book, and it's totally free for you today. And how about that?
I love it. Should I go to a question yet?
Yes, let's go to a question, and let me just remind prospective callers, the number's 866-870-5752 right here in the studio. And do not delay. The hour goes quickly. It's all yours.
Okay, so I just got a question in about 5 minutes ago, so I'll take that one because it's an interesting subject. Tons of people come in with low back pain. Of course, I treat the whole body, so everything from the back of the head with headaches and neck and back pain, shoulder pain, elbow pain, muscle pain, wrist pain, finger pain, arthritis, hip pain, knee pain, ankle pain, toe pain. Doesn't matter really where it is. The procedures that I do, which are either injecting your own platelets, we just draw your blood and inject it after we spin it in a centrifuge to take out the red cells. We inject it back in. It can be done anywhere on your body. Now, this doesn't work, or it doesn't work the way I do it, at least, for disease states. People call up and say, will this help my macular degeneration? Will it help, lupus? Will it help things like that? No, not directly that. And I don't do things IV, intravenous. I do musculoskeletal work, okay? And the other type of treatment we do is bone marrow stem cells. It takes me about 10 seconds to get the bone marrow out from the back of the pelvis. Very quick, simple procedure. I numb up the area, and then we extract or aspirate, as we call it in medicine. The bone marrow, we spin it if we need to. Sometimes we don't need to spin it, just depends what part of the body. And then we inject it back in. So they're very simple, quick procedures. You walk in and you walk out. You don't need someone to drive you, okay? People are always like, oh, is this a terrible thing? As I've heard bone marrow extraction is so miserable, blah, blah, blah. Not the way I do it, it's not. And this is not a bone marrow aspiration for things like leukemia, where they take a large amount out and do it quickly. That can really hurt. The way I do it is just a small amount and slowly, okay, over the course of about 5 to 10 seconds, and it's not disruptive for people. It's very simple. So the question is about chronic SI joint dysfunction. That's what the email says. And the person says, I'd like to learn more about whether or not I'd be a candidate for PRP or stem cell treatment for chronic SI joint dysfunction. So SI joint is the sacroiliac joint. There's a wedge in the back that attaches, it's a wedge of bone called the sacrum. It attaches to the pelvis in the back. So iliac means the pelvis, so the sacroiliac joint dysfunction. Now, I have never found anyone that had SI joint dysfunction, ever. I've been doing this a long time. And I've had people that have had bolts put into their SI joint, literally big bolts to hold it together, who get worse when they do that. I've seen people have all kinds of surgeries done that didn't work. And typically, I know surgeons don't like to hear this, but most of these things in the neck, back, and the SI area, that's the sacroiliac area, have to do with sprains, like a sprained ankle, but in the neck or back. And that means the ligaments are sprained. And Nita, do you remember the word that you love so much?
Enthesopathy.
Yes. I've got her all like the what do you call that? Skinner. Remember
Skinner's
Skinner?
rats. I prefer to say Pavlov's dogs. I like dogs better than rats.
B.F. Skinner did it, and when the bell rang, were they rats that ate, or they rang the bell and they got? Yeah, they actually rang the bell themselves, did they? And then they got a little piece of food from it.
Yes.
So when I say, "What's the word that you love the most?" Nita goes, "Enthesopathy."
I can even spell it now.
So these SI joint dysfunctions, these low back problems, I've injected the entire back from the neck all the way down. Most of it, I'm not saying all of it. There's never an all of it type of diagnosis, but most of it is, and this is even if you've had a failed surgery. Okay, you've had a surgery, you've had 2 surgeries, didn't work. it's typically the ligaments that hold the bones together. Ligaments are pieces of collagen that hold bones to bones. And in the low back, we have the sacroiliac ligaments and plus some others around that area. We also have the iliolumbar ligaments. We have the interspinous ligaments. And we can inject all of those and get rid of these enthesopathies that Nita is talking about. If you want to go to your Google and look up the word enthesis, spell that for us, Nita. You're good.
enthesis.
Darn good, yeah. Look that word up. What happens is there's an irritation where the ligament attaches to bone. And that's probably 99.9% of neck and back and sacroiliac pain. I have people that come and have all kinds of injections with steroids, which I don't like to have people do because it actually dissolves away tissue. There are occasions where you have to do it. Someone's really flaring and they're absolutely miserable, they can't stand up, then it's a great idea. But to have these injections done and chronically, meaning over the course of time, is a terrible idea, in my opinion. Just little old me, Marc Darrow's opinion. So I had someone come into the office 2 days ago that had, I don't remember the number, but their knee was injected probably 30 or 40 times with steroids over the years.
Ouch.
What did that do to the cartilage in the joint? It dissolved it away. They had very severe arthritis, and the tibia bone, which is the leg bone, did not sit straight on the femur bone, the thigh bone. It was off to the side. Okay? So that is something that we want to stay away from. If you're getting steroid injections, please look up on Google what that does to the body. And the typical steroid that you hear used is cortisone. So if you're getting cortisone shots, go look it up before you have another one. You won't want another one. So what do we do instead? We stimulate the body to grow more tissue and heal it and rejuvenate it. Okay? It's not about quelling the inflammation by putting in a strong steroid. It's all about regrowing it and healing it, and then the pain goes away. It's a slower process, I admit that. A steroid can work in a couple of minutes because there's lidocaine mixed in with it, which is a local anesthetic, so it feels great. And then guess what happens when it feels great? You use it and wear it out even more. And I did that on my right elbow. I had a steroid shot in the lateral epicondyle when I was playing a lot of tennis. It was while I was a lawyer back in the day, and I didn't know any better. And so it felt so good, I went out and played tennis. Guess what happened? It got really bad. Finally,
Ouch.
I learned about when I was in medical school, in my 4th year, I learned about doing these regenerative medicine techniques. I injected my own elbow and healed it up. So, we haven't had any callers yet.
We do. We have Julian.
Oh, we do. I wasn't looking there. Okay. Also, for those of you who do want to call in, the phone number to the studio is 866-870-5752. Grab your pencil. I'm going to repeat it, 866-870-5752. And while you're writing that down, if you want to call the office, there's people by the phones. The number to the office is 800-300-9300. So I'm going to go to Julian. And Julian has a hip that's bothering him, and about age for this type of procedure. Okay. So when you say, Julian, are you with us, by the way?
Yes.
Hello? Okay. So your hip has bothered you for how long now?
No, it's not. First of all, good morning, Dr. Anita. I called because I have a relative that went to a facility that gives the PRP and stem cell treatments. Because she was 90, they said that she would not be a good candidate, just dismissed out of hand because of her age.
Julian, do me a favor. Get your mouth closer to your telephone. You're a little bit raspy and it's not clear.
Okay.
And yell. We don't mind you yelling and screaming at us so we can hear you.
Did you hear anything? Do I have to repeat?
I heard all of it. I just want you to be clear.
Okay.
Go ahead.
Right. So my question would be: I think, well, is biological age a better predictor of outcome using the stem cell PRP treatment than chronological age? Because they dismissed her as being a good candidate because she was 90 years old.
Okay. I don't want to comment on the clinic, but I can tell you that they're not doing a whole lot of this, because I do this every day on people who are what we'll call elderly. I don't know what that means anymore. And they get very good success. All right? So I don't know what their idea is about that. It works great. I've used it on young teenagers. We get a lot of athletes, young athletes, and obviously all the way up to people in their 90s. I've done a few people who are 100, and they've done well also. So theoretically, when you talk about stem cells being old, I don't know what that means, because if the person is alive, they are producing, their bone marrow is producing stem cells constantly and releasing it into the blood constantly. Okay? There's reparative, regenerative things going on in the body no matter how old you are. So again, that's my opinion. They're allowed to have their opinion, but I can tell you I do this on elderly people every single day of the week with very good success. Anything more to that question?
Thank you very much, Doctor. No, that's it. I think you answered the question. Thank you very much.
Okay.
Thank
You're
you,
very
Julian.
welcome.
Thanks
you.
for your call. We appreciate all callers at 866-870-5752, right here in the studio, 866-870-5752. And let's go to Ray in Los Angeles.
Hey, Ray, did you ever watch The Three Stooges? Are you old enough for that?
Yes, I did.
So here's what I'm going to have to say to you. I've got a week back, and then I'm going to ask you, or you're going to ask me for how long. And I'm going to say, about a week back. And then Nita's going to laugh.
I like that.
That's all before my time.
Yeah, that's great. My dad is 82, and he has all kinds of jokes like that. So I'll have to try to remember that one for him. I appreciate your show. Thank you for this great information that I'm hearing. I'm 55. My mom is 78, and we just had a vacation in Florida. She came down from New York. We came from L.A., and on the way down, she grabbed a bag and ripped her back and came to vacation anyway, and she couldn't walk or move, and she has this back pain that, she strains it, and she's been to doctors. The doctor said, we'll have to get you an MRI. I think she said she had one injection before, which was the steroid, the cortisone, and that gave her some relief. But, here, and I have a lot of back pain myself. I have like a bone density issue, probably not getting enough vitamins, probably not doing the greatest diet, and lifting something super, super heavy. About 2 years ago, I cracked a vertebrae in my back, and I fell down immediately. I heard a pop, and I fell down, and then I was at work, so I tried to, say, I'm okay, and I got up with extreme pain, and I actually worked the next few days and got an appointment with a specialist. It took me 3 weeks to get in, and when I finally got in, I got the MRI and got in front of the doctor a month later, and he said, do you know that you broke your back? And I said, yeah, I think, I had a feeling something wasn't right back there. But my whole point is that, I'm very, very interested in the in some type of repellent treatment for myself, for my mom. I've had shoulder surgeries, and I've inquired a little bit about these injections. And I don't want to use the cortisone, but would it, I guess my question is, where could my mom get some information in New York? Where could I get some information in L.A.? Where could I actually sign up for the injections? Because I know the insurance might not cover it. I looked into it for a minute, and it was real expensive. So I'm just looking for some direction and some information, and
Wonderful. The first place I want you to go is to my website, which is www.lastemcells.com, and on any page there, you can ask as many questions as you want, and you can also ask me to send you a free copy of my book, Stem Cell and Platelet Therapy, and the byline is Regenerate, Don't Operate. It's sort of, I'm going to call it my Bible. I don't know if it's other people's Bible. It's certainly not the surgeon's Bible, because it says don't do surgery, and it's got the study showing why not. So it's not something that surgeons believe in a whole lot, but it's something that I've been doing all of my medical life since my residency at UCLA, where I learned about it, and it's been a miracle on my body. I've injected my knees, my elbows, what else? My right wrist, both of my shoulders. I've had some of my friends who do this work inject my entire spine and the ribs in my back. Hundreds of injections on me, because I can take it. I know it works, and it's worked every single time. It's worked every single time I've done it on myself. So I'm a believer.
Let me ask you a question in regard to a shoulder surgery. I had a shoulder surgery. I've had a couple.
Get your mouth closer to your phone. You're a little raspy, okay? And then talk louder, please.
How about that? Is that better?
That's beautiful, yeah.
I had a couple of shoulder surgeries, actually, on each side. First one lasted a while. It ripped again. They went back in. They sewed it up again. The left shoulder's holding with 2 surgeries with a lot of pain and scar tissue. The right shoulder popped again about a year and a half ago, and the doctor wanted to do a replacement. And I said, I just can't go through this again. So all of the other muscles in the shoulder are working except for the one that tore and never repaired itself. There's certain movements I can't do, and I'm in a lot of pain. Do you think that the injections might help the current situation I'm in?
I'm not going to promise you or anybody anything, okay? That's number one, and I tell every patient who comes in that. I haven't examined you. I'm not your doctor. I can't tell you anything at this point. Do you understand why?
Yes, I do. I do.
But my experience is that I can help most people. Yeah. My experience is I can help most people. That's just a generalization. Really so listen, you've given me a book worth of questions here, and I want to start answering them for you now, okay?
Yes.
So your mom had, I'm going to say, probably a sprain of the ligaments in her back, reaching over and picking up that bag, typically very, very easy to fix using PRP or bone marrow. Bone marrow has PRP and stem cells in it. PRP, for those of you who don't know what it is platelet-rich plasma. It just means the platelets in the blood or in the bone marrow, okay? My experience generally is bone marrow works a lot better, which has PRP and stem cells, than just drawing blood in the arm and using the PRP from that. They're both good, but the bone marrow is better, okay? The next thing I'm going to go to is...
That's a real blessing to hear that, because, I mean, she literally came home from Florida. She went home and stayed in bed for 2 weeks, and she's an active person.
Okay. So the next thing I'm going to deal with, you're going to have to let me blast through these so that I can get to some other people. And we're coming up to the break soon, too. But you have a lot of great questions, and I want to answer all of them. So you had a bone density done. You had a bone density done. It shows that you have osteoporosis, which everybody eventually gets if they live long enough, if they're not supplementing with hormones. Okay, and I use bioidentical hormones on myself and other people. And for a man, we would, the first thing we do is we would check. I'd look at your bone density, and then I would do a urine test for what's called NXT. It shows how much collagen you're excreting to see if the balance in the bones is okay or not. And then I would, if your testosterone and DHT and free testosterone, all these things are low, hang with us and I'll get right back to you. And
Okay,
Don't
hold
go
on,
away,
Ray.
folks.
Okay, and you're listening to Living Pain-Free with Dr. Marc Darrow. Grab a pen or a pencil, write down this important information coming your way. I'm your host, Nita Valens, and we'll be right back.
You're listening to Living Pain-Free with Dr. Marc Darrow. Dr. Darrow's practice is located at the Darrow Stem Cell Institute in West Los Angeles. To schedule an appointment, call 1-800-300-9300. That's 1-800-300-9300. Dr. Darrow will be back in just a moment. Stay tuned.